What is split brain syndrome after callosotomy surgery? Imagine your brain as a busy city with two neighborhoods connected by a main road. When that road is cut, each neighborhood starts to operate more like separate towns. That's what happens in split brain syndrome after a callosotomy. This surgery involves cutting the corpus callosum, the thick bundle of nerve fibers that links the left and right sides of the brain. It's usually done to help people with severe epilepsy that doesn't respond to other treatments. The goal is to stop seizures from spreading across the brain. Normally, the corpus callosum acts like a bridge, allowing the two halves of the brain to share information. When it's cut, communication between the two sides is disrupted. This leads to some fascinating and strange effects. For example, each hemisphere begins to work more independently. The left side of the brain, which handles language and analytical thinking, can't easily share information with the right side, which is more involved in spatial awareness and visual processing. This split can cause odd behaviors. For instance, if a person sees an object only in the left visual field, which is processed by the right hemisphere, they might not be able to say what it is. But they could pick it up with their left hand because that hand is controlled by the right hemisphere. Meanwhile, their speech centers in the left hemisphere might not know what the right side is doing. It's like having two brains in one head that don't always agree. Some people might notice their hands acting on their own. One hand might undo what the other just did. Or they might respond differently to the same object or command, depending on which side of the brain is involved. These effects show how each hemisphere has specialized functions, and how the brain can sometimes act as if it's split into two separate minds. While these symptoms can be confusing at first, many patients adapt over time. The surgery often helps reduce the severity of seizures, which can greatly improve quality of life. What makes split brain syndrome so intriguing is how it reveals the brain's modular nature. It shows us that consciousness and perception are not always unified, and that our sense of self depends on constant communication between the two halves. This condition has inspired many experiments and questions about how our minds work, making it a fascinating example of the brain's strange and mysterious inner world.